Welcome back. This video talks about how to handle emergency visits at ACES Dental. Now that you know the protocol for ACES, which is access the patient, chart, call patient, explain what procedure is being done, and provide safety measures, you can now proficiently handle a patient with an emergency. Our motto at ACES Dental is to stress less and smile more, and that applies to not only our patients, but also our employees. The emergency kit has the basic kit, HVE, which stands for high volume evacuation, which is nothing but your high-speed suction, saliva ejector, which is the same thing as your slow-speed suction, gauze, articulating paper, floss, X-ray sensor with its plastic sleeve, and the yellow X-ray kit. Whenever you see a patient who is an emergency, always ask the patient for the reason why they made this appointment. Typically, this will lead you to take an X-ray of the tooth that is causing them some pain. But make sure you get the doctor's approval before taking that X-ray. Sometimes when patients have had recent fillings or crowns, they may complain that their bite is off. If this is what the patient states as the reason for his emergency, make sure to put out a handpiece and a burr block in addition to the emergency kit. If the emergency is something else that you have not encountered before or are not sure of, it is always best to pull the doctor into the op first. When a patient is scheduled for an NPA emergency, meaning a new patient exam emergency, the fastest way of going through this appointment is to take all the X-rays at the beginning and then bring the doctor in to do the exam. However, the patient has the right to choose if he would prefer to have the area of concern or the tooth that is causing him a problem to be examined first, and then the full mouth X-rays or examination be done. So explain to the patient that this can be done in two ways. I can either do all your X-rays, get all the information I need, then call in the doctor, so the doctor can carefully look at the tooth that is bothering you and also look at the other teeth around it. Or we can call the doctor in first, he can take a look at the tooth, then we're going to take the X-rays, then we'll have to call the doctor back in again. That does make the appointment long, but some patients prefer it. Most patients will be okay with a full mouth exam and X-rays done prior to the doctor walking into the office. Once the X-rays have been completed and the doctor has asked you to write down their diagnosis, proceed to enter this information into Curve, have the treatment plan signed, and inform the billing department. And that is how you finish a successful emergency appointment.